Hi everybody, and welcome back to our discussion on Chapter 14 for training in sport. So when we are training for a particular sport, it's all going to be about managing stress. So when we think about stress, inherently we think of being overworked, being tired, and just kind of psychologically exhausted. But you need to think of stress kind of in a new way. Stress is going to be just anything that is going to cause a physiological or psychological response in the body. So we have two different types of stress. Most often what pops into our head is distress. This is bad, negative stress. Feelings of being overwhelmed, overtaxing the body. But we can also have good stressors. We refer to these as eustress. This is a positive stress. So this is like going to the gym. I'm going to work my body. It is going to become fatigued. It will then compensate, and we can improve performance there. So when you're writing programming for a sport, you need to work on how to manage the stress. So when you have the appropriate stressors in place, we see increases in performance, increases in satisfaction, increases in strength, increases in endurance, lots of wonderful things that will happen. However, if we overdo it when we train our athletes, we're going to lead to a couple different things. Most likely overtraining, injury, or burnout. These are all very negative experiences. So how do we actually go through incrementally managing stress? We do this through a concept called balanced training or periodization. Within this, we have four distinct principles that allow us to appropriately program. The first one being progressive overload. That means I need to continually try to progress you through an exercise, and I need to continually overload the system. So you can think about this: if I want to get stronger and I start doing bicep curls with a 5-pound weight, if I never move past a 5-pound weight, I'll get stronger initially, but I'll stop seeing results. Therefore, I need to constantly be improving and making things more difficult if I want to continue to see results in my performance. The second is called the SAID principle. It stands for specific adaptations to imposed demands. You may also hear this heard of as the principle of specificity. Basically, if I want to get better at something, I have to do that something. So if I want to become a better runner, that means I need to go run. If I want to get stronger, I have to actually go deal with resistance training of some sort. That doesn't necessarily mean that I can't have some gains in one area cross over to another, but if I want to get better at a particular task, I need to do that task. So if I want to become the world's best marathon runner, I can't go swimming and expect to get better. Your third is the concept of reversibility. You may also hear this referred to as use it or lose it. That means any strength improvements or improvements that we have, or endurance improvements that we have, can always go backwards. So we constantly need to continue training if we want to see improvements again. If we stop training, we go backwards. We go through a period of detraining. And then the fourth is just kind of some individual and genetic differences. Everybody is granted different strengths genetically. I always hold myself up as an example. I am clearly not a runner. I do not run. My endurance is terrible. I am an asthmatic. Being an endurance athlete is probably never going to be my thing. However, I was granted with being very strong. So genetically, I am more disposed to doing strength and power activities than I would be towards endurance. Now, this does not mean I cannot train to be an endurance athlete. It just means I probably won't be the best endurance athlete there ever was. All right. So when we keep these four things in mind, we tend to see the best performances and improvements in training for sport. So we don't follow these rules. Let's say I progress somebody too quickly, or I'm not doing the right exercises with specificity, or I'm not giving them enough rest. We get into things when things go wrong. The three things we're mostly concerned with here are something called overreaching. There's a cat, I apologize. Overtraining and exercise addiction. So overreaching, this is basically using excessive intensity or volume, or appropriate volume and intensity, but not giving somebody enough rest. This tends to be a temporary state. It can be recovered from. but you need to take intentional time to rest and recover. You can have both functional and dysfunctional overreaching. Functional overreaching, I am intentionally pushing you past a point because I'm going to have you rebound and give you lots of rest. Typically, we see this in a transition between different sports seasons. Dysfunctional or non-functional overreaching, this tends to start to lead to the potential for injury. When we start looking at this non-functional, dysfunctional overreaching, we start to get into something called overtraining. Overtraining, basically what we're going to see here is we're going to have some increases in sympathetic activation. Basically, the fight or flight response is constantly on. These people are highly stressed. You're starting to see some psychological issues because they're constantly trying to deal with trauma that their body is perceiving. You're going to start to get hormonal imbalances. Cortisol levels are going to spike. Testosterone, growth hormone are going to start to drop. We're going to start to see declines in performance. You're also going to see an increase in your inflammatory response and a decrease in your immune function. So these individuals tend to get sick more quickly and more often. They will also tend to be chronically exhausted. Some may start to run a fever. Some may have elevated resting heart rates, elevated blood pressure. Additionally, the mood and the psychological symptoms are going to be there as well. So anxiety, depression, just other basic dysfunctional thought patterns. So these two we want to try to avoid, but we also need to be aware of individuals who may struggle with something called exercise addiction. Exercise is a wonderful thing. It gives people a lot of confidence and self-efficacy and a lot of positive things. But if you are constantly working out and never giving yourself a break, and you just keep pushing and pushing and pushing, you're going to end up with maladaptive and dangerous behavior patterns. This is something that we want to pay attention to, especially with our younger athletes who you have to rein them in a little bit more. So on the flip side of when things go wrong, we also have to make you rest at some point, which are some other considerations. So I have two types of lowering the activity levels. I have detraining and I have tapering. So tapering is an intentional lowering of the volume of exercise, but maintaining the intensity. Typically you go through a taper before you have a big competitive performance like a conference championship or things like that. I'm wanting to maintain your fitness level while giving your body a chance to recover. So tapering is very common. Usually this is going to take place over somewhere between 6 and 2 weeks before the big competition. And you're trying to give as much recovery as possible while maintaining performance integrity. On the other side of things, we have detraining, and this leans a lot into the concept of reversibility. Detraining basically is your body trying to return to the state it was previously before you went through a training protocol. Everybody needs to have a period of detraining. You can't constantly be on the gains train. You have to recover at some point. This is fairly normal. We tend to see this in an off-season type of time when we're just telling athletes to be active, but we're not actively training for something. If I have a soccer player, instead of having them constantly training for soccer, giving them a rest period and say, hey, during the summer, why don't you go swimming and go hiking with your friends? That means when they come back, they're not going to be in the best soccer shape, but they need that recovery period to maintain the continual performance enhancements. So hopefully this was a nice little summary for you guys about training in sport. If you are interested more in this, please come take my PHE 230 class or the brand new, fully formed PHE 240 class. So have a lovely day, guys.